record feature for our session, so please be mindful that we are now recording. Again, welcome to today's webinar. It's hosted by DBHR through the Washington State Healthcare Authority. This session is intended to be interactive, so I certainly encourage folks to keep cameras on, to prepare to put things in the chat. And I believe we are a small group this morning, so we can also utilize our microphones as we are thinking about developing accommodations for people with mental health conditions in the workplace setting. A gentle reminder about AI. In terms of the use of AI, we are asking that any automated note-taking bots or similar tools during today's session, it needs prior approval. Unauthorized use of tools, AI bots, is prohibited to ensure privacy and confidentiality of all attendees. There are times during today's session where we will do some activities and pause the recording, and we want to make sure that we do not have any bots in our session that is, recording information that we were hoping to give a little bit more privacy and confidentiality with. Please be mindful in the future, if you do need a recording device, if you use it for your accommodations as assistive technology, we can certainly work with you in getting that approved for the session. My name is Amy Banco, and I am a faculty member at Rutgers University's Integrated Employment Institute. I've been with the Institute since 2017, and my role within IEI is to train and provide implementation support to career service providers, predominantly in the state of New Jersey, but I've worked with practitioners in New York City, Pennsylvania, Kentucky, Washington State. My additional roles at Rutgers is engaging in and conducting research on supported education and supported employment for people with mental health conditions. My PhD, that I am still working on my dissertation, is in the field of counseling with a focus on traumatology. And my dissertation topic is on the longitudinal outcomes of supported education programs, looking to see if supported education services help people to graduate. Prior to coming to Rutgers, I was one of the co-developers of New Jersey's first supported education program. I provided direct service, team supervision, program oversight, and evaluation for over 10 years. I also saw the integration of support education with supported employment, seeing New Jersey's first career service integrated program modality. My passion is helping people to recover from their mental health condition by enhancing social determinants of health. Right. So we typically see people utilizing the public mental health service system in our vocational services who have been chronically unemployed and experiencing profound impact of poverty on their wellness and decreased social determinants of health, including lower education attainment and decreased financial stability due to unemployment. And so my passion is helping people to get back into the workforce, get back into the primary labor market, get off of benefits, get into, careers that afford them a high quality of life. I am so eager to learn about you and all of the fabulous practitioners in this virtual space today. So please go ahead and introduce yourself in the chat. Hey, Darren, great to have you here today. Good to see you.
Good morning. Good morning, everybody.
If you can go ahead and introduce yourself into the chat, share a little bit about where you're coming from. You can share your role, your organization. Even what brought you here today. What brings you to a training on developing accommodations for people with mental health conditions in the work setting? Great to have you, Brady. Awesome. Ellen, nice to see you. Oh, that's a new county that I've never heard of. Is that pronounced? I don't even know how to say that. Coloma County? That's
Clallam?
awesome. Thank you. I knew I was botching that. Hey, Brittany, vocational specialist. Great to have you. For individuals working in the justice involvement sector, Lara, great to have you. Pioneer Human Services in Seattle. Yeah, excited about accessibility empowerment. I love that. Yes, we share that passion for sure, Allie. Helping folks to self-advocate and to have that support to succeed and excel. Nicole, great to have you. Carrie, a vocational specialist, great to have you here today. Employment consultant for Exceptional Foresters. Thank you. Awesome, awesome to have you. We have so many different diverse practitioners in this space today. That's amazing. Coming from different places in Washington, different program modalities, working as an employment consultant. That's amazing. Another employment specialist, Francine, great to have you. Working with individuals who are unhoused, experiencing housing instability. That's amazing. That's such an area of need, great need. Some people from Spokane. I've been there and in my outings with Washington State. That's a beautiful region. Hey,
Spokane.
Tech, Spokane. Am I
Spokane.
saying that? Spokane.
Spokane. Yeah.
My apologies. I am just botching the names of
Sorry, I
towns.
was I was born and raised there, so
No, thank you. I appreciate it. I don't want to be mispronouncing your areas.
thank you.
DVR, great to have you from DVR today. Welcome, welcome. Oh, recovery coach. Awesome, David. That is very much needed work. Yeah, Mike, always excited to learn about accommodations. I am very excited about today's topic. It's really, when we think about resources and supports, this is one support, workplace support, specifically tailored for workers with disabilities and health conditions. And it's an untapped resource. So I'm really excited to chat more about this today. Welcome, everybody. Please, if you haven't had a chance, go ahead and put it in the chat. But thinking about our session for today, I always like to start with my community learning guidelines. I think it's important that we have an understanding of, you know, and an agreement, if you will, of how we're moving through our virtual space. And so just a gentle reminder that everyone is coming in with beautiful, complex identities. And as we navigate our virtual space today, I always ask for that utmost respect, a stigma-free zone, hoping that everyone leads with curiosity, and this piece about co-learning. There are 40 of us in this virtual room, and all 40 of us bring in our experiential learning, our competencies and skills. Everyone in this space, um, can learn from another individual here today. And so I really urge co-learning. Share your experiences, ask your questions. It will benefit others in this space, myself included. So thinking about our work for today, we're going to define accommodations in the employment setting, wrap our heads around this piece of functional implications and that verbiage. We're going to talk a little bit about accommodation types and assistive technology. And hopefully, if we have time, we will get to this piece about application and service conceptualization. Moving forward, right? How are we conceptualizing providing accommodations for the folks that we are working with? And so when we think about, um, I always like to frame employment services in the context of the stage a person is in, right? As we're providing IPS services, we're tailoring our interventions to like where that person is at in their employment goal. And when we are thinking about accommodations and job maintenance, it's really, helping people to keep their job, to stay engaged in the role of worker. And so we're talking about like job tenure, job maintenance. And that's really a time for us to provide some tailored coaching and support services. There are many things that we can do when we are providing our job coaching services. Sometimes we do some stuff that's on site. More often, we do some off site job supports um, because of that concern that people have in terms of disclosure and accessing supports on the job site. And so we want to be really mindful how we're intentionally tailoring supports for a person's job success and their satisfaction. I always mention job success and satisfaction because we know that when a person is feeling good about the work that they're doing, when they're satisfied, and when they're feeling successful, meaning they're getting positive feedback from their colleagues, their coworkers, their evaluators, like a supervisor or manager, they're going to have better job tenure, right? They're going to increase that job maintenance, which is fabulous, right? That is a goal that we're kind of helping people achieve. And so we want to think about the types of supports that we can provide for job seekers, for workers. And oftentimes we're really good at these top three: helping people to build natural supports, getting connected with their coworkers, utilizing family or friends, right? Digging deep into building these relationships with folks that may or may not have a disability, that are not paid providers. We also may be really good at connecting people to community supports. I know a lot of what we do is, helping people to get transportation, navigating, public transportation or accessing, shared rides, things of that nature. And then we are ourselves a part of the formal supports, right? Helping people to connect to agencies and services that they're entitled to based on eligibility criteria due to the nature of their health condition. But areas that may not be as attended to is this piece about accommodations and assistive technology. What we see in research is that relatively few employees with mental health conditions formally request accommodations. The number in the years has been growing. Research indicates that overall, only a minority of workers with all types of disabilities, this is like the larger population of individuals across the board with different disabilities, request accommodations. One survey that was published by the NIH found that 17% of employees with any type of disability requested an accommodation. When we think about mental health conditions specifically, many people choose not to disclose their condition at work, which can impact and impede or preclude them from accommodation requests, right? That diminishes that accommodation request rate that we're seeing. And when we look at literature, fear of stigma is often cited as a significant contributing factor for employees foregoing requesting those accommodations. Despite this historical underuse of accommodations, we see in recent trends an increase in accommodation activity related specific to mental health conditions. Employers are reporting more requests for mental health accommodations, especially this is a 2024 employer survey that noted that 74% of respondents, and these were employers, 74% of the employers saw an increase in requests for mental health related accommodations. And this was from 2020 on, so the 4 years. And employers really felt like this surge could have been influenced by greater awareness of mental health needs, the impact of the COVID-19 pandemic on employee well-being, and also potentially this reduced stigma around help seeking. But we still see a considerable gap in terms of the need, right? The employees that have needs and uptake. And so that's what we kind of want to be mindful of throughout today's session, that this is an underutilized resource or support, that there are very real concerns like stigma and discrimination in regards to disclosure. And we want to be mindful of the process of requesting accommodations in a manner that reduces that likelihood. And we'll get into that in just a second. So as we are getting started, if I went too far, I'm going to put you guys into a small group activity where I'd like for you I will share this slide to the breakout group rooms, but I want you to chat with your colleagues, your virtual colleagues, of what comes to mind when you hear the term accommodation and to your level of comfort, right? Again, this is our virtual space, and I want to be mindful of everyone's comfort level. Consider, are there any type of formal or informal accommodations that you might use in your personal and professional life that you're comfortable sharing? So I myself am a person who has lived experience of a mental health condition, and I had accommodations all throughout college. I do have an accommodation right now at work related to not my mental health condition, but another medical condition that I'm allowed to wear masks. I am immunocompromised, and so when I am in person, I'm wearing masks to prevent further disability from any COVID infections. And that lets me to do my job safely and prevents, again, further disability. So I'm going to put you guys into a breakout group room, and you guys can talk about what comes to mind when you hear the term accommodation. And you can share a bit, again, to your comfort level of any formal or informal accommodations that you yourself may use for your success on the job. Any questions? I see some things going in the chat. Let me open up the chat. Any questions before we go into our rooms? All right, see you guys back in a few minutes. Does anyone need help getting to their room? Please let me know. I see a few folks that have not moved over into the breakout group room. If you do need help, please let me know. Let me pause the recording. Resume recording. Ultimately, when we are conceptualizing that piece about what comes to mind with accommodations, we really want to emphasize that workplace accommodations are adjustments or supports that enable and support employees with a disability, including mental health conditions, to succeed and perform right in their jobs effectively, to give them equal opportunity to thrive in this life domain of working. Accommodations eliminate barriers. They eliminate barriers caused by society. They are changes that enable a worker with a disability to perform the essential functions of the job. And they are changes that enable a worker with a disability to enjoy equal benefits and privileges in that work environment, to engage in all aspects in that environment, like individuals without a disability. And they should be determined, right? This is a very important piece, considering how symptoms interfere with performing those essential functions of the job, right? When we use that term, functional implications of a mental health condition, that's just a fancy way of saying the specific ways in which a disability affects the individual and how they are able to perform activities in the work domain, right? And so accommodations, really, again, when we think about it, can be changes to application process, tasks and duties that, how tasks and duties are completed. And it's important to note that these things can include specialized equipment, like we noted, I think it was Lara who talked about assistive technology, right? And are determined by looking at those functional implications, how the disability is interacting with the environment. That is very critical as we're kind of looking at the formula for accommodation development. Let's see. See from someone in the chat. Happen to their expertise and have financial resources to implement some of the essential job requirements. This can include job coaching and supports. Absolutely. Yes. Job coaching can be an accommodation. I have definitely done my fair share of side-by-side job coaching for folks, and then doing some off-site job supports for people who did not want to have me on site. So that is certainly, that piece about being on site is an accommodation. When we think about accommodations, um, do they matter? Do they matter? Do they make a difference? Is it something that impacts people, right? Where we work, sometimes very tirelessly to advocate, to help the person advocate on their own behalf to access accommodations. But what do they really yield for a person? Well, a growing body of research shows that workplace accommodations for individuals with mental health conditions are effective. They are effective in improving job retention, improving productivity, and very importantly, employee well-being. We know that implementing accommodations can really help a person to stay employed and to support their performance on the job. A systematic review published by within the NIH looked at studies that concluded that providing workplace accommodations with mental health conditions really mitigated workplace limitations and improved job tenure. So in other words, employees with conditions that, like depression, anxiety, were more likely to keep their jobs when they had those accommodations in place. And notably, accommodations positively affect health outcomes, right? We found in this systematic review some evidence that accommodations can reduce some of the severity of mental health symptoms, likely by reducing maybe some of that stressors on the job. And what's really important when we think about this, the efficacy of accommodations, um, the pragmatic, practical side of employers are wondering, well, like, okay, this is great, but like, at what cost? We know that workplace accommodations are often achieved at little cost. We see that most accommodations are low cost or free of cost. In fact, a 2020 survey prepared by the Job Accommodations Network, acronym is JAN, for the Department of Labor and Office of Disability Employment Policy showed that 56% of workplace accommodations cost absolutely nothing to implement. And the remaining ones, right, that additional 44% cost under $500, right? That's phenomenal. We can see that the efficacy, how effective accommodations are, it's that is bi-directional. It's a win-win for the employer and for the employee. And there's little cost involved. In fact, I was doing this presentation for Inclusively with Microsoft, looking at from the HR perspective, right? Developing workplace environments that are disability friendly. And there was I think it's a 2020 Accenture Disability Inclusion Research Report. And they found that in terms of utilizing workplace accommodations, workers that access them, employers that offered them, they were reporting 28% higher revenue and 30% higher economic profit margins for the employers that responded. So again, I think of this concept of bi-directional. Accommodations are helping the person to access and have, better inclusion in the work setting, better job tenure, but it also enhances the experience for the employer, right? Which is, I think, something that we can add in our advocacy efforts, in our job development efforts, if we are job developing and disclosing, right? If your part of job development discloses, right, that you are supporting individuals, workers with disabilities. And so when we think about, I see some things in the chat, my apologies. Many of our employees who would not be able to work without accommodation. Yes, Carrie. Yes. Folks may not, they would be precluded from the work environment without those supports in place. Amazing point. And that is true for many folks, right? That if they weren't to have those supports in place, they may not be able to maintain their employment. So from my experience, I have spoken to the manager with a person in service for getting an ROI. Currently I'm trying to speak with HR for another person while job searching. Amazing. Yeah. What, if any, financial resources for nonprofit employers to provide accommodations? Great question, Christy. DVR, Division, well, in New Jersey, it's Division of Vocational Rehabilitation. I think in your state, it might be VR, Vocational Rehabilitation. There's nuances to that title in every state. But DVR in New Jersey will help to pay for accommodations. There are also nonprofit disability organizations that will lend assistive technology to folks and or provide that assistive technology at free or no cost. I do have some sites in New Jersey that I'm linked up with. I don't have those resources for Washington, but I think you might have some similar organizations in your state. When we think about this piece, though, about accommodations, oftentimes some of those frequently utilized or common accommodations that are utilized would be things like flexible scheduling, adjusting work hours, right? To someone mentioned in the chat earlier to go to doctor's appointments. You know, I worked with a bunch of people in supported employment who were on psychotropic medications, and their medications had side effects that included severe fatigue. And so a part of their accommodations was having that flex schedule, right? Let's see. In terms of accommodations, we also see remote or telework, right? Helping people to work from home, work remotely, to have control over the environment, time off, additional leave can be a part, like accessing, sick leave or personal leave specifically for mental health needs. Modified break schedules, right? Putting more frequent breaks in. I think you guys identified a lot of these, right, in your discussion. And when we think about these accommodations, it's important to get the perspective of the job seeker or the worker. By far and large, when we look at the literature, I know anecdotally, the work that I did in the field, people would say accommodations make or break their experience. But me being, coming from that lens of research, right? I want to know what is the consensus? Are we seeing themes, trends? And so qualitative research that has been conducted to understand the real life impact of accommodations have noted that employees generally report that accommodations are invaluable for maintaining their employment and also their mental health and well-being. We see that when organizations are more supportive, when the climate is more supportive, that makes a difference as well for individuals with mental health conditions on the job. Especially, they find it easier to request and utilize accommodations when they're in a supportive work culture. And so sometimes our efforts are not merely about making a good job match based on values, interests, and preferences. We might want to put into that profile in making a good job match. What is the work culture or climate like in terms of disability services and accessing, those types of supports on the job, right? We know that work culture can also, for employees, be just as impactful as receiving those accommodations. But ultimately, when accommodations are in place from the employee perspective, they find benefits significant. They feel like their job satisfaction increases. And they also feel greater loyalty, which is interesting. I'm sure that relates to that increased job tenure. They feel greater loyalty in these qualitative studies, right, to the employer when they are being appropriately supported and accommodated. They also study participants noted improved well-being, less stress, and a feeling of being valued by their employer. Right, so we do see it makes a difference. Now, there are two ways that people can receive accommodations: formal and informal. Formal refers to the structured approach and measures implemented by the organization to make a request to have accommodations provided, and that's delineated in company policies, procedures, also the legal framework, which we'll go over in a second, including the ADA. And so this is a process, right? Formal accommodations where there is most likely an application or submission of documentation noting a person's presence of a health condition that typically goes to human resources, not the supervisor, not the coworker, right? The disclosure of the nature of the disability solely goes to HR or a representative in that particular role, and accommodations are then put in place protected by the ADA. Informal accommodations, in contrast, are when someone experiences flexibility that is often an improvised response to the needs of the employee with that mental health condition. And this can be, you know, a way for people who are feeling uncomfortable at disclosure to kind of like circumvent that formal process, right? There are some benefits into accessing informal accommodations, and there are some disadvantages. So let me give you an example. I was working with someone who had PTSD from combat, and they were, you know, seated in an office that they had their back to the wall, right? They had hyper arousal, as many people with PTSD do. And there was a lot of hypervigilance and scanning of the environment, and having their desk, so their back was against the wall, helped them to be more productive. They were less hypervigilant and less hyper aroused. And that was just something that their supervisor said, sure, no problem, like put your desk there. That supervisor left. And a new supervisor came in and wanted to redo the office. And they wanted to put this person in a high traffic spot where there's a lot of people. It was like almost like right by like the area where the copy machine was, and this wasn't going to work for them. So that informal accommodation gave them, right, the what they needed to be successful, and they didn't have to go through this, like, you know, what might have been viewed as a cumbersome process. But when leadership changes, or even if like the whim of the acting supervisor or current supervisor changes, there's nothing in place for that supervisor to enforce those things. They are negotiable. It's up for removal or termination of that informal accommodation. So it doesn't safeguard, right, that person's access. So really, you know, it's I think something that we have to kind of work with an individual to discuss, like, what are the options? What are the pros and cons of those things? And if they're looking to safeguard those supports, right? How do we do so in applying and doing so to have those accommodations in place protected by law? And I have to, you know, the section on legislation is definitely an area where I am, like, in this current political climate, hyper vigilant on. Every day I wake up like checking to see if like these laws are still in place and we still have protections for individuals with disability. So I always do this section now with the caveat that as of right now, right, the Rehab Act of 1973 is still active, with Section 504 of that Rehab Act prohibiting discrimination against individuals with disabilities. We also know that the ADA, enacted initially in the 1990s, and amended in 2008, is still active. And these particular pieces of legislation, again, call for the equal access, right, for people with disabilities into employment settings and educational settings. The ADA applies to employers who have 15 or more employees. And so when we think about that, it's just a way to kind of like safeguard, legally safeguard those accommodations that are in place for people, right? That if they are receiving formal accommodations, we know that the ADA protects them in terms of receiving those supports. So thinking about when we are working with individuals and they're in the process of applying to jobs, right? Just to kind of get the ball rolling, thinking about the disclosure process and what that looks like for um, employers and for accommodations. I would like to throw this out to folks. Are applicants required to disclose disability on an application or during an interview? What do we think? I'm seeing no. A question about the ADA. Yes, if they have less than 15 employees on payroll, they do not have to follow the ADA law. Correct. No, required to disclose. Depends on disability. No, not required. You're right. Right. Individuals are not required to provide information about a health condition, right? An employer cannot require an applicant to undergo disability questions, a medical examination, right, before making a job offer. If the job requires physical fitness tests, agility tests, things of that nature, then that is something that has to be provided to all job candidates. It's not something that's arbitrarily done, um, right? That anything in relationship to medical examinations, those things are done right after a person accepts a job, right? And they are going through that like process, that medical evaluation process. And that can be for some employers with some job titles, but again, it has to be across the board, right? People can't just randomly say like, oh, you have to complete this medical exam and get a physical before starting this job. So when we think about stage 2, receiving conditional job offer, right, and disclosure, that means an employer has said they want to hire an individual, but maybe that individual has to get a physical or medical exam done prior to. After a conditional job offer, the employer may ask disability related questions. And again, this has to be across the board. They may require an applicant to undergo medical examination. Again, this examination is something that has to be required for all employees in that same job category. It can't just single out one person and say, oh, you need this medical exam. It has to be part of the process for that particular job. And the employer may not withdraw the job offer because of the results of the medical exam, right? And that is with the caveat that unless the disability interferes with the essential functions of the job, and it can't be accommodated by a reasonable accommodation. And so we think about stage 3, current employees, right? An employer cannot require an applicant to disclose medical conditions unless, right, the person is they're seeking disability related information when it's job related and consistent with business necessity, right, as per the ADA. And so they may ask a question in terms of medical need and offer reasonable accommodations to offset, right, whatever essential functions that might not be met within that particular that job and that particular worker or candidate. And so when we think about, right, knowing what the rights are, knowing how an employer can or cannot inquire about disability and the presence of health conditions, it's important to know our steps then in how are we determining, what are we doing to determine an accommodation for an individual? What is the process that we can go through to accurately identify the appropriate accommodation to offset that functional implication of the mental health condition? And so, first and foremost, the accommodation must be a medical need, must be based on a medical need and it cannot compromise the essential functions of the job. So let me give some examples here. I was working with a person who had a diagnosis of schizophrenia, and they were on a medication called Seroquel. And a side effect of Seroquel for this person, for a lot of folks, is fatigue and drowsiness and difficulty getting up in the morning. And so they were requesting with their employer an accommodation to have a more flexible schedule. I think David mentioned this earlier, right? The flex schedule with his group that he was talking with. And so this person, got it in writing from their doctor, submitting to HR, right? Medication side effect needs to be accommodated with this flexible schedule. So they would come in a little bit later due to that medication side effect related to their health condition. Another person that I was working with, they had a diagnosis of OCD and they had a child. And they frequently in the morning would be late to work because they were getting their child ready for childcare, for daycare. And so their tardiness to work was related to challenges in getting kiddo to childcare, and the traffic related to getting their kiddo to that childcare location. And so they wanted a flexible schedule, right? And they wanted to get that accommodation in place to come at a later time. What do we think about that? Is there medical need there? Is there medical need there for this person who has a diagnosis of OCD? Could be. We might need some more information. If it's related to their diagnosis and their doctor can attest to it, Laura. Yeah, lots of steps that could be activating that morning routine. Yes, because of the need of OCD, but depends on side effects of medication. So when we think, if someone is saying, right, that there are no symptoms related to that tardiness, right? That the OCD is not what's presenting. It's they in fact had health anxiety OCD in relationship to themselves, and it was not a contributing factor, right? It was not a part of the delay in getting to work. Those symptoms were not a piece of, like, there was no. I know what folks are saying in the chat, like maybe they were experiencing like those intrusive thoughts or compulsive behaviors that were delaying. We walked through all of that to kind of get a sense of like what's going on in the morning. And it was really like trying to get their kiddo dressed, trying to get like they're getting stuck in traffic. They lived by like this very busy highway here in New Jersey that was like always like bumper to bumper in the morning, and so it wasn't disability related. There wasn't this piece of the health condition impacting their schedule, right? So there wouldn't be a medical need, right? Could it be accommodated because of childcare needs? That's certainly a conversation that they could have with their supervisor. But a doctor wouldn't be writing to attest to that medical need if there was no medical need there, right? If it's related, in fact, to childcare. Still important to get that support in place for childcare, right? But we got to be mindful that it wasn't meeting the criteria based on what they were reporting. And so then we see that piece of essential function, which is, are we compromising a core function of the job? So there was a person that I was working with who had a diagnosis of PTSD. They were an administrative assistant, and there was one part, a job task, that they would go into this like lower level area to get boxes of copy paper to put into the printer. And being in this lower level area, the visuals was triggering for their symptoms of PTSD. And they would frequently, right after going down into this lower level area, experience that hyperarousal, sometimes disassociation, and they would have a very hard and unproductive day. And so the accommodation that we had requested was that someone else get that computer paper, that they don't have to go down into this basement area that is so triggering, right, for their mental health condition. Getting the computer paper was not a key piece of their job. They were able to get this deliverable, this task off their list of to-dos because it wasn't why the position existed. It wasn't a large portion of what they did. It wasn't even on, right, where we find those essential functions is a job description. And that was not something on their job description. So that accommodation was permitted because it wasn't removing an essential function of the job. So we want to be mindful, right, of what are the essential functions, look at the job description, and this piece about medical necessity. What are those functional implications? And I'm giving you a tool today to have this conversation in a very tailored fashion. So this is an assessment that I've been using for many, many years. I use it for the domain of education and the domain of employment. And you can use this as a conversational piece with the folks that you're working with to get a better sense of what their mental health condition looks like, the symptoms of those mental health conditions, and super important, that third column, what are the functional implications, those employment implications of your symptoms? And then we flesh out from there, what are possible accommodations? What are other resources that we could put in place? Or even areas to develop some skills. So I would use this with some open-ended questions. I might start with a person asking them, can you tell me a bit about your health condition in your own words, right? What are some symptoms or some things that you experience because of your mental health condition? Describe how this condition makes it hard for you to work sometimes. Describe the parts of your day at work that feel most challenging. Are there times during the day when your condition affects your work? Can you describe those times? Right? Can you describe how your condition affects your ability to work with others or in the team? Again, using like my good communication skills, some open-ended questions, coupled with a lot of reflections to fill out this worksheet. I do have samples of this form filled out for various mental health conditions, and you'll be provided that sample in the email that Darren will be sending out. That lists conditions like depression, anxiety, bipolar disorder, schizophrenia, with some very common symptoms and potential functional implications, right? How that job, or excuse me, how that symptom is affecting them on the job. I'm going to put into the chat. This is a Google document.
I didn't understand.
Oh, I don't know if that link transferred over. Copy link. Okay, the Google document that you see here in the chat, please go ahead and click on it. You'll also get a Word doc version of this document in the email that Darren will be sending out to everybody. And that has listed this assessment, a blank version. It also has listed, I use in conjunction with this form, JAN. JAN is the Job Accommodations Network. This is a free service offered by the U.S. Department of Labor's Office of Disability and Employment Policy. And their role is to provide guidance on workplace accommodations. And they are, leading experts on disability employment issues. You can use JAN to research under their website, mental health conditions. They list mental health conditions separately So you can go to their website and look up anxiety, depression, schizophrenia, and it'll give you a good comprehensive overview of that particular health condition, the symptoms that a person may experience, and some of the functional implications of that condition. Coupled with accommodations that have been successful in reducing, mitigating, attenuating those barriers. You can search again via the condition, you can explore via accommodations. And one great feature about Jan is that you're able to consult with experts. You can contact a Jan consultant to get more personalized solutions and advice. You, the provider, can contact Jan via chat, via email, or phone, and they will carve out time to walk through with you or the job seeker or the worker what could potentially be put in place to support that worker's success. They will also give you sample letters to provide to employers, right? Case studies, fact sheets, and toolkits, all to support accommodation proposals for employers. They will even speak to employers. I've also found Jan to be assistive in supporting students in the post-secondary education domain. So this is really a fabulous resource. There's one tool that I use in terms of Jan's recommendations for developing accommodations. They have a guideline on how to monitor the effectiveness of accommodations and how to provide a feedback loop mechanism to make follow-up suggestions to ensure that accommodations remain effective over time. And we noted that earlier. Someone in the comment section said, all right, look at, accommodations as temporary rather than permanent. And that's a great mindset to be in because accommodations will need to be updated. I remember working with someone who they were in supported employment services and they had a diagnosis of depression. And for quite some time in working with them, I understood their symptoms to present in a certain way. And then they had a life event. They had the passing of a loved one, and symptoms were, naturally increased or exacerbated by the natural grieving process, the grief and loss process. And they needed different accommodations, right? I saw them, experience a higher need after that loss. And so we had to kind of rework the accommodations to better suit what was going on and where their wellness was at. I think it's the Mental Health Association too that has a campaign. This campaign is called Before Stage 4. And it basically asserts that mental health is not an absence of, right? We don't have like, oh, an absence of wellness or a bucket of wellness. It's on a spectrum. At any point in time, our wellness can be um, experiencing ups or downs. And they delineate these 4 stages of mental health wellness with this notion that stage 4 is, right, the most significant and severe in terms of presenting of mental health symptoms, where a person's in crisis, where they're not able to function in their life domains like they want to. And they liken it to medical conditions, right? We think about medical conditions like cancer. We don't wait to stage 4 to treat it. We get ahead of it. And we provide different interventions at different stages. And so when we think about the development of accommodations, we really want to be mindful of, what a person could experience at all different stages and accommodate to that most severe stage, even if they're not presenting with those severe symptoms in the moment. Right? We know that mental health conditions are chronic and cyclical, and having those things in place for if that person experiences an increase in symptoms can be very, very beneficial. So I do see some things coming into the chat. Yes, I will make sure that everyone gets this document in terms of a Word doc, right? That will be sent out via Word doc, and Darren will send that to folks. The question. Oh, was this a question on the reasonable piece of the accommodation? When we think about reasonable accommodations, and the cost of those accommodations, right? The ADA states that it shouldn't be an undue hardship on the employer. Remember, oftentimes what we see in the literature, and this was, I think, a national study, 56% of accommodations cost $0. $0. And the other 44 were under 500. And so I think it's really contingent upon what type of employer it is. Um, you know, thinking about less than $500, that would probably seem really reasonable for the majority of employers. And there are resources that we can use to get at some of those more higher cost accommodations or assistive technology, whether it's through VR, vocational rehabilitation. Um, there are other disability groups that will offer trial periods of certain assistive technology or outright give them to workers. Um, Again, I will try and see if there are programs like that in your state. I know in New Jersey, we do have different types of associations, nonprofits that freely give out assistive technology for workplace accommodations. Thinking about the work that we do using the assessment that I provided, oftentimes when we are learning more about how a mental health condition impacts a worker or a college student, we start to learn a lot about executive functioning. This was like an aha moment for me as a practitioner. Um, in that executive functioning, right, are the skills um, that we utilize, really the cognitive building blocks that underpin um, our complex, higher level cognitive processes. And when we think about executive functioning, um, we really rely on executive functioning to be successful in the work domain, in the educational domain, um, socializing, you name it. If you are talking about a life domain, we are utilizing executive functioning in some capacity. The model that I frequently refer to in terms of executive functioning skills is Dr. Thomas Brown. He is a clinical psychologist, and he bases this off of, I think, some of his work is predominantly with ADD and ADHD, but across the gamut in terms of health conditions, executive functionings can be found in 6 key areas. One is activation, and that refers to a person's ability to begin a task or to do things independent, right? To start a task independent. Um, and people with mental health conditions can struggle with task initiation. I think about maybe that person with OCD that had health anxiety, and maybe while they were at work, they were experiencing a lot of intrusive thoughts, compulsive behaviors. They would do a lot of like checking, and because of those symptoms, they would struggle with that task initiation. Um, Things like focus. The second domain is focus, and that involves maintaining attention and concentration on a specific task or goal. That focus can be impacted by a multitude of mental health conditions, from depression, anxiety, schizophrenia, right? You name it, focus can be impacted. Um, effort. Effort refers to the ability to exert energy and persistence, and not just now initiating a task, but completing a task. And then emotion. Emotional regulation is an executive functioning skill. And that encompasses regulating mood, in the pursuit of, goals and goal-directed behavior. Um, Interestingly enough, in my work with and research on executive functioning, we see that procrastination is really more about emotional dysregulation than time management, right? People will procrastinate tasks often because they prefer to do activities that are more pleasurable, right? So if I'm working with a student in support education who has a 15-page paper due, they're going to opt to potentially scroll TikTok, right? Because that is a feel-good activity, whereas writing that 15-page paper, that may call upon a lot of emotional regulation, especially if people struggle with thoughts of perfectionism or low self-efficacy, right? Avoiding a task, procrastinating on a task, maybe avoiding thoughts um, of, again, low self-efficacy, low self-esteem, right? And that requires a lot of emotional regulation to manage, right, some of those distressing cognitive distortions. So when we see emotional regulation, that's very closely tied to this piece on procrastination. The fifth category in Dr. Brown's model is memory, right? And that's the ability to retain and retrieve information when needed. And we could see how mental health conditions could affect memory. A lot of times people are doing like metacognition, right? Where they are trying to work on a task at work, but they're also simultaneously maybe splitting their attention between what distressing symptom they may be having, right? I think about that person with the intrusive thoughts, the person with PTSD, as they're trying to, manage wellness while on the job. And then the sixth category in Dr. Brown's model is action. And action refers to the ability to plan and execute tasks efficiently. And so we want to be mindful when we're thinking about building accommodations to focus on this executive functioning piece, because this really can make or break a person's success. We know that when executive functioning needs are accommodated, or in the least, we develop compensatory strategies to support these areas, people thrive. I think I see some things coming into the chat. I think I might have the executive functioning categories broken down on that Word doc that I sent you. I do have multiple handouts with those executive functioning categories. Okay, Kay, it might be in another Word doc. I will include them. I have a Word doc that lists each of those categories, and then I have a checklist on how to assess those categories, right? How do you observe those different categories? And that's a whole another training that I conduct, but I will share that with you guys because it's very assistive in the accommodation process. And so when we think about developing accommodations, especially for executive functioning, one of the things that are underutilized is assistive technology. There are many options for assistive technology, and it's important that we, just like the accommodation process, tailor that same process specific to assistive technology, in that we develop and devise a plan tailored to that person, and then periodically check in. We know that up to 50% of all assistive technology is abandoned by the user. And that could be due to a mismatch. That could be due to uncertainty in how to utilize the AT, the assistive technology. So again, we want to think about creating a plan, supporting that person in getting acclimated with the piece of technology, whether that's working with the person to develop the ability to use it effectively, to link them with training, and then evaluating, assessing, following up essentially. How's it going? Is this meeting your need? Are there barriers? It's never one and done. Accommodations and assistive technology, like we said, is a continuing process, a continuing conversation. to assess and evaluate for efficiency, and that it's meeting a need. And so thinking about that piece of assistive technology and accommodations, what have you guys done in your practice? What does it look like? Are you supporting people and getting connected to assistive technology? Yeah, so okay. Yes, DVR has an assistive technology team. Haven't come across the issue yet, but definitely want to be aware of how to use these tools. Absolutely. Yeah. I had a person that needed a watch to keep them on task. Love that. Often help with tools like smart watches. I love the smart watches, smart pens, all different types of recording devices. Amazing. Now, when we think about the different types of AT, it can be low tech or high tech. There can be paper-based tools, things like planners, calendars, journals, to help individuals with mental health conditions stay organized, to manage schedules and tasks effectively. It could be stress balls, fidget tools, tactile aids to help people to get that sensory input or to de-stress, to reduce anxiety or restlessness. High-tech solutions can include mindfulness and relaxation apps. These apps and software can provide guided meditations, breathing exercises to reduce hyperarousal, improve that focus and concentration that we talked about in terms of executive functioning. One of the most fascinating pieces of AT that I've been using recently is digital note-taking software, tools that enable workers to take and organize notes, digital notes, to make it easier to review and access information. Right? You think about someone who's in a meeting, they're experiencing symptoms, they have that digital note-taking software, they can refer back to that particular point in that meeting, right, where they were experiencing those high symptoms. Speech to text software, text to speech software, these types of assistive technology can assist. I use it a lot for individuals with schizophrenia, actually, the speech to text. Sometimes the folks that I was working with that had schizophrenia were reporting challenges with typing, just the process of like trying to um, get their thoughts in an organized fashion and then type it out was particularly challenging. And so that speech to text software, removing that piece of typing, was so very assistive for folks in getting their work tasks done or their papers if they were in school. Um, right, there are a whole bunch of different pieces of assistive technology, cell phones, smartphones, the smart watches, smart pens. If you're not familiar with the smart pens, they are pens that come with specific types of notebooks. The pen itself is a recording device, and as a worker is recording their meeting and writing, they're able to take that pen and put it onto the paper, right to, let's say, where they maybe, that person with PTSD had to get up from a meeting and take a break because they were experiencing a lot of triggers or flashbacks. They could take that pen and put it to the page where they left, and that's where the recording will pick up. They'll be able to hear exactly what they missed when they took a break and, went out for a breather. So there are all different types of pieces of assistive technology. Jan has a lot of information on that assistive technology component. I would highly recommend, um, going through each of those pages on mental health conditions, even sitting down with the folks that you're working with to build their knowledge and awareness of their legal rights of accommodations and what's available to them based on the symptoms they're experiencing. We can even support uh, workers in getting connected on a call with Jan to talk to representatives and feel empowered to talk about their own needs and access to their legal rights of accommodations. So we are about 10 minutes out from the end of our session. This Meet Olivia is the Google Doc that I have connected you guys to. In that doc, you'll see a scenario that talks about a worker, Olivia, and her needs. I don't know if we have enough time to review, but maybe I can highlight the other document that I was talking about with um, the executive functioning checklist and executive functioning descriptions. I do want to open up for any questions. And I will pause the recording as we are doing